my perception of therapy was something I didn't need. I had this very proud mindset as well that I would somehow be able to get out of my problems and that I wouldn't need any of that. But I think that was really, really something that I wish I could have said to myself earlier, which is, you are just a human being just like anyone else is. And if you were to give advice to a friend who was going through the same thing, what would you say to them? And my advice to a friend would be, go get professional help. You've gone through a big life event, get help.
Many of us doctors have experienced trauma as a result of our work and our lives, particularly focusing on the work scenario. Medicine as a career is highly rewarding, but also extremely challenging. And it's guaranteed that you will come up against all sorts of stresses, as you would call it, or significant events or traumatic events. However, why is it that as doctors, having access to that mental health support, when we know that working in healthcare has quite a significant occupational risk when it comes to mental health, why is it that we're not able to access mental health services as easy as it probably should be, or even acknowledge or recognize when we need help, and also being able to ask for help? So in today's episode, we will be focusing on the simple question, should all doctors have therapy? And in order to address this question and to run through this conversation, I've invited a really good friend of mine, Dr. Will Gao, who is the Chief Operating Officer of Suvera, which is a VC-backed virtual clinical services company, which is looking after patients with long-term conditions. And I've known Will for a number of years through Medic Footprints. So he came and participated in quite a few Medic Footprints events, even when he was at medical school. And it's really powerful to hear his story and experiences of some mental health challenges he faced and how he managed to progress through that, and using much of what he's learned in that experience to support a thriving team of people in his company. So have a listen, please reflect on this conversation and let me know what you think. And before you do so, make sure that you subscribe if you've been listening for a while. Join our mailing list or join our community at medicfootprints.org/join our mission. And please, please, please do spread the word. We want as many doctors really knowing that that is a door that can be opened for them if they choose to open and go through it. If they are looking for other ways to develop themselves personally and professionally, using medicine as an absolutely amazing foundation in their lives. Anyway, on to the podcast. Let's face it, burnout amongst doctors is sky high, and we're actively seeking other ways to make the most of our transferable skills beyond the usual career pathways. Welcome to Disrupting Doctors' Careers. I'm your host, Dr. Abena Bubbs-Jones, and I'm on a mission to connect 1 million doctors across the world with the best in diverse career opportunities. So for today's episode, we are going to be focusing on therapy for doctors. Should we all, as doctors, be engaging in therapy for the duration of our careers as doctors and beyond, or even before we even get into medicine? That is a question that I've always asked myself, especially working as a consultant in occupational health and working with companies such as NHS Practitioner Health in the past, who are dedicated to supporting doctors in their mental health concerns, and as someone who has also had mental health concerns themselves through their career. But I'm really just excited to introduce you to Will. So Will Gao, I've known for 7, 8 years or something along those lines, from when he was a medical student. And now he is the co-founder and chief operating officer of Suvera, which is a VC-backed virtual clinical services company. He can tell you a little bit more about that. But the reason I've chosen Will to have this conversation today is because of his own experiences and observations, and as a leader in healthcare who is growing a team himself. And so the question is, should doctors be having therapy? So anyway, welcome, Will. Thank you so much for joining.
Thank you for having me. What a brilliant introduction.
Brilliant, thank you. I just did it on the fly. It's like one of those things that comes with practice.
Yeah.
So, let's get started a little bit about your background. And so, I knew you from when you were in medical school and you were kind of considering alternative careers and that jazz. So,
yeah.
Tell me a little bit about your journey and how you ended up in a startup.
Yeah, well, I think first of all, to the question of should all doctors, go to therapy, I think it highlights a bigger issue of should all people look after themselves and their mental well-being. I think that's what that really reminds me of. I think my journey into med school was one that was probably fairly familiar to a lot of kids as well. I had a very strict Asian parents. They were from China. They wanted to see a doctor in the family. So there was very much this whole thing of you really need to do this, you need to do that. And personally, I was always interested in the science and always interested in trying to help people and look at human body. But I think there was definitely a lot of sort of parental pressure going into it. And I think that was, a small element of the decision to do it. And so when I was in medical school, I quickly realized that there were lots of things that weren't to my liking. And I was very fortunate as well to be in UCL, which was very much a hub of lots of interesting and fascinating people, and very much got quickly picked up into this new world of innovation and tech and what could happen in healthcare. And sort of at the same time as well, really jumping into the kind of the depths of it, was my mum unfortunately got ill when I was a student. So I was in my sort of second year of exams. I remember it was the day before sitting the medical school exams, and for any UCL listeners, they'll know second year was very much the worst year in terms of academic exams. It was brutal, and it was dropped at the dinner table that mum had cancer, and only being in second year, you still don't know that much about medicine, and so I was trying to dive deeper and trying to find out what was going on.
Time, Will?
I was 20
so
at the time.
Really young, relatively speaking.
Yeah, exactly. And it was one of those, not to exaggerate, but it was one of those life-defining moments, right, where I remember going upstairs and trying to continuously revise about the anatomy for my exam the next day, knowing fully in my head that, my mum had just been given this diagnosis of what I didn't realize at the time it was terminal cancer. And the reason I bring it up in conjunction of why startups is because really there was a lot of soul searching over the next 2 years. I continued on with med school. I thankfully passed as well that exam. I don't know how I got through it, but I think the adrenaline and everything got through it. But during my sort of third and fourth year, I spent a lot of time going backwards and forwards to hospitals with my mum, getting chemotherapy, being that kind of medical person, when you get, as you are the medical hat, I was there for all of it.
Medic in the family, the minute you get in the
family,
you're excited to know it all.
I mean, some of these oncology drugs are so far beyond what I'm doing. Anyway, I did my bit and ended up taking a year out towards the very end of her life, because I realized that there wasn't much time remaining, and I wanted to prioritize the time, because I was blessed in a way that I knew it was coming, and not a lot of people get that sort of pre-warning. So I ended up spending about four months of good time with her. And then once she passed in 2017, I went back to med school to finish off the final sort of two and a half years of clinical training, and I felt really lost. I felt really, really lost, and wasn't myself. I didn't know what myself was. I mean, your identity as a person when you lose someone so close to you is shaken. And I started asking myself, why was I in medicine in the first place. Obviously, I had the parental pressures, mostly my dad, and I was trying to make sure that mum and dad were happy and all this sort of stuff. And I thought, well, if mum's no longer here, she just want me to do what I really wanted to do. And then that all intertwined with, getting support from friends and family. And that was when I first was introduced to talking therapy, because I needed help at the time. I was 22 when mum passed, and it was a lot to take in, and there was a lot of soul searching, which has led me to sort of where I am today, which was to make the decision to go with my heart and to leave clinical medicine but still stay in healthcare.
It must have been such a challenging experiencing for you at such an early age, at a pivotal time in your life when you're, growing into your identity or your profession, and to lose, one of the biggest rocks or foundations in your life and closest relationships. And so, I mean, my next question for you is, what were your perceptions of therapy before you actually started? And what was that experience like initially?
Yeah, so pleased you asked that, because it certainly wasn't talked about in my household. I had an older brother, a very, very traditional dad who didn't believe in showing emotions. So my perception of therapy was something I didn't need. I had this very proud mindset as well, that I would somehow be able to get out of my problems and that I wouldn't need any of that. But I think that was really, really something that I wish I could have said to myself earlier, which is, you are just a human being just like anyone else is. And if you were to give advice to a friend who was going through the same thing, what would you say to them? And my advice to a friend would be, go get professional help. You've gone through a big life event, get help. Whereas you can give the advice, but sometimes you just don't listen to your own. And that was something I really listened to going forwards. I thought, whatever I tell people, I should do myself. I'm no different. And I think that really was a turning point, because I started to get the help, and it got my life back on a good direction.
Thank you so much. And I completely identify with that. I think it's quite a common experience for carers or people in healthcare to be able to give professional advice, but not really use and practice that advice as efficiently and regularly as we should. And I can definitely attest to that, because I remember even when I was in occupational medicine training and supposed to be looking after myself, that's when I actually burnt out and ended up on the other side of occupational health, getting advice from another occupational health physician on how I should be looking after myself and being kinder to myself and slowing down and all of that jazz. So and that's actually my first entry point to having therapy, and cognitive behavioral therapy in particular, even though I'd prescribed and advised it to like hundreds of people beforehand, but never actually gone through it myself. So I mean, that also leads to just generally speaking, if we look at doctors and their experiences now, and also peri-pandemic, and the challenges they faced, particularly around the trauma they've experienced within work, should all doctors be offered therapy, mental health therapy, as a kind of standard, or even a prerequisite to actually go through it before they even start their jobs? It's a very controversial topic, but we like controversy here. So what are your general thoughts on that?
There are so many levels to unpack there. I think what you said about being a carer is so true. You're in a unique position as a medic, and let's be frank here, so many of us identify, it's a strong identity being a doctor. I mean, it's who we are, and therefore there is a sense of wanting to feel like you've got things under control. People come to you, non-medics always come to you for advice about absolutely everything. And so it almost, for me anyway, and I'm not sure if other people resonate with this, but it felt like I was letting myself down and letting other people down by showing those weaknesses. And it's there's a big stigma to it. And I think lots have changed in recent years, but we should be very open to being vulnerable about not being okay. And I think should therapy be sort of compulsory or be offered to everyone? I think certainly I've found so much value just as a person being able to talk to someone professional about things. And there will still be people who have resistance to it and have a stigma to it, which is, that's okay. But often these things is, you don't want to wait until something bad happens for you to then seek help. Because for me, therapy is just a preventative thing now. It falls under the same category as making sure that I eat well, I exercise, all of those good things. And it's only when people really, really are finding things difficult, when they become receptive to things they otherwise wouldn't have been. So for me, if you'd have said to me, Will, when I was 18 years old, you said, would you think you'd be getting therapy at 2021? I'd be like, I'll be fine. I've got my life in order, everything's fine. But when I needed it and things weren't working, I was doing the exercise, I was doing meditation, I was doing all these things to try and keep myself well, but it wasn't working. I thought, I really need to let my guard down and not be such a, to try and be so strong about it. And so I think it should be offered to people, whether it be compulsory. It's a whole funding question. If that's even available.
Always is a funding question.
But certainly I think if more people can just say they've had it and it's been helpful, and that, do it, even if it's prophylactic, preventative. It doesn't have to be once you're struggling and depressed.
Or maybe it's a cultural question to say that, we look at professional development, right? And part of our professional development is the well-being element and making sure we look after our health, etc., and recognizing that medical practice in particular can come with a lot of baggage when it comes to stress, trauma, mental health. Should it be signposted to a lot more frequently, like in people's appraisals, ALCPs, that kind of thing? Not, even as you just described, as a preventative, check-in, rather than assuming that if people haven't brought it up, then they're fine. Do you know what I mean? Because I even remember the year that I literally had to take time off, that there were lots of red flags that I didn't see because it's me, but other people had pointed out numerous times. But, if I didn't see it, and then nothing was actually offered at the time, but then looking back, had I actually picked up on it, or someone suggested, listen, we really think that you need to, or you could consider, not need to, if they forced me, I definitely would have gone. But say, have you considered doing this that may help you with this, that, and the other problem? Then I probably would have been more receptive to it, and it could have prevented, me even needing time to take time off work. And so, I definitely agree with you on that preventative level, in the sense that, I now have a regular therapist on a weekly basis, and that's been for the last few months. And that wasn't because there was anything crisis level wrong at the time. It was more of a realization that was an investment into myself, holistically, and especially dealing with some challenges that I could foresee in the future, not now, but in the future. So, do you know many people in general that treat it prophylactically in that sense, as you just described?
Well, I'm the same. I've been seeing people, a therapist on a regular basis for about for a year now. I've had therapy for many years, but never as sort of as ongoing as this. And I actually don't know many people who do it as often as that still. And for me, it's not just to make sure that you're feeling happy or feeling better. It's a lot about understanding yourself as well, because a common thing that I sometimes get asked from friends who are interested in therapy is, can you not just chat to a friend about these things and work through these things with mates? And don't get me wrong, I share so much with my mates, and we can talk very openly, but there's often for those who haven't tried it, when you have a dedicated professional or someone who is there just to help yourself, you really get deep into the conversation, and you can really reflect on what it is that's led you to those thought patterns. And it's just peeling back those levels really gets you to understand yourself in a completely different way. And I still find it so helpful, because I almost treat it as a life coach in a way. I mean, that might have a more of a sort of a sexy feel to it than a therapist, but
you could probably call it that, depending on how you because there's a lot of overlap between coaching
there's a lot of overlap, a huge amount of overlap. They're looking at the way you think, the way you bring yourself to a problem, and you can't separate your emotional state from, let's say, a professional or a personal. life as well. And that's something that I've realized, that if something's happening in your personal life, you will bring that energy to your colleagues and people, whether you like it or not. And so looking after yourself, or spending that time to really understand how you respond to things, will inevitably impact so many aspects of your life. So it's yeah, as you might imagine, I recommend it.
Yeah, I mean, I'd love to hear a little bit more about how you went about finding a therapist.
Yes.
Because I mean, the standard at the moment in the UK, and the NHS is that the NHS does offer counselling or mental health services through IAPT, which is improving access to psychological therapies. The challenge that a lot of people face with IAPT is that, as you can imagine, it's severely oversubscribed, and there's a huge waiting list. For doctors and dentists in the UK, there is a practitioner health programme, which is a remarkable service, which is NHS funded, for doctors with mental health concerns. You don't need to have a diagnosis for this, but again, massively oversubscribed. So especially for those who are looking for, longer term support like yourself, what are the resources, where you can find the best therapist, or and B, how do you know it's the right person for you moving forward on the longer term, and the type of therapy? Because, as you know, there's a whole range of different forms of therapies that people can experience. I know a lot of practitioners are, practice a kind of bit of everything, kind of, integrated. Some are very specific in their approach. I mean, what was your experience like?
That's such a great question, by the way, because it's I think, just to highlight and address it in the open, it's not cheap therapy, and I think it's unfortunate how little the public services can offer for it. So I personally went through university to begin with, so I was given free sessions with a therapist through university when I was a student, and then afterwards I was on the IAPT queue for, it felt like forever, and especially when you're not in a good place, that time feels extraordinarily long. So I think it was 6 sessions with the IAP, which is the maximum I think they gave me at the time. And then I ended up looking for a therapist using the BACP website, which still today seems to be one of the more robust directories that are out there. And I ended up having to pay for it out of pocket, which, like I said, it wasn't cheap, and unfortunately it will create this divide, right, of those who have more resources will be able to get more help. It's such a big problem because it's not affordable for most people. And one thing I did find helpful was I was able to be given concessionary rates as well. When I expressed that I had financial difficulties, they were happy to offer slight discounts, but that is completely dependent on the person offering those services. I think the other side of what you kind of asked as well was, how do you know it's the right one, and what do you look for? And I'm still relatively young in the sense of how many years and people of therapists I've seen, so I might come back to a different answer in 5, 10, 15 years time, but the ones that I've worked,
I expect a different answer in 5, 10 years, so things change.
I think certainly finding, so I definitely cycled through quite a number, because you have the introductory calls, which I think you should always do, and just get a feel for if the person is right for you. I also was completely perplexed by all the different types of therapy. I couldn't quite grasp my head around which ones were person-centered. It's like there were so many different things, and I ended up going for just a counsellor who would talk with me rather than using particular techniques. But I think the most important thing is that you trust that person, because I certainly had certain therapists where I didn't feel like level of trust, and I felt that there was probably a bit more judgment than was helpful. And as soon as you notice those things, I think you should trust your gut, because then you won't open up properly. And if you don't open up properly, you completely lose the benefits of what having a dedicated amount of time to go deep into a topic is. So I would look for trust, and that's the priority in terms of the way to get the most out of it.
Totally agree. And I guess trust, with that, like anything, it just takes time to build up, but it's also about the chemistry that you have with that person. which chemistry is pretty much immediate, but then you've got to wait for the longer term and just use your intuition and gut. But I think it is one of the benefits of finding someone that you're self-funding rather than going through IAPT or NHS, because you don't really have much of it or any choice really.
So hard.
So yeah, there's benefits and challenges with both options basically. But I think if we're talking specifically about doctors, who, as we assume, most doctors will have some kind of financial income, but those in financial difficulties can also get support from organizations like the Royal Benevolent Medical Fund, I assume, if they're really kind of struggling. But I mean, I personally see it as an investment in myself, rather than a kind of added expense. Just like money that I would spend on going out for dinner or cafes, or like getting my hair done, things like that. The day-to-day that we spend, and actually kind of totals up quite a lot if you look at how much you spend over a month. Or like, for example, I was spending money on a course a period of time. I would see this as just as important and the same kind of thing, but very much bespoke to me, and not necessarily any tangible outcomes or certificate at the end of it, but something I know that I'll be taking micro steps through as I progress as a person, as an individual. So I mean, I'd love to hear your thoughts along those lines. Like, how do you see it?
I totally agree, and that is such a key point, because it's the perception of what it is for you, is that you see it as something more than just it helps me when I'm feeling down. I think that's the common perception of it, and it's you're so right. It is an investment in yourself, just like you would do if you were to get like a gym membership, was like just so that you could look after oneself. And I just think you often, as we touched on a little bit before, but you can't see yourself that well, what your red flags are sometimes, because you're in your own head. And the irony with mental health is that the one organ that you need to be functioning well in order to catch these things, the thing that's failing you. So you can't even sometimes see when your decision making is poor, or when you start making those bad decisions and the habits get worse. And it's so fundamental to everything, to be able to feel well about yourself, but also to think clearly. And they just have so many outward benefits that I certainly see it at the moment, where in my role, and also as a partner to my fiance, and as a brother, and all these things, I know that in order for me to be my best for them and to do it justice, I need to look after myself. I want to be able to support other people, and it's you hear it all the time, but you have to look after yourself before you can look after multiple other people. It's such a cliche statement, but until you've really, really been able to catch yourself going down what could potentially be a spiral, and you actually are noticing your red flags, and you're actually preventing it, you realize just what the potential gains that you've saved yourself, both in time and energy and all those other things. You're more in tune with oneself, and I think that's really the heart of it.
100%. And a lot of what you said I completely echo, and I'd love to, we've got a few minutes left, I'd love to hear more about, now that you're in a leadership position in Suvera, the health tech company, how have you used your experience and knowledge and the importance of therapy, and how are you using that in establishing a really positive culture and supporting those who may or may not have mental health and well-being issues? Like how are you embedding that in to look after your team as you grow?
Right, so you said you want to be controversial. So I think that the people are the assets of your company, right? It's all about the people, especially in a remote working world now, when people are just in their own homes, in their laptops. You realize that all the other things, like a fancy office, all these, they're just material things. What's important is the individual people. And the reason why I said this is going to be controversial is that I personally felt, going through med school, and my colleagues who are now doctors, you felt very dispendable. You know, you could be replaced very easily. And I think that's not good for culture when you don't feel valued, and that will mean something different to everyone listening to this. Is what's your value when you work for your employer? And it was highlighted in a lot of areas in the pandemic as well, that they didn't protect the staff, and by not protecting the staff's mental health as well, the repercussions are huge. Look at the number of people leaving, and it's and the question about what are we doing differently at Suvera. It's all about the culture. It's all about being able to be open and honest, and I see every single person as the assets to the company, because without them we would be absolutely nothing. We might be left with an empty office space. Oh, what's that good for? It's all about the people. And I think I wish that the NHS would consider that more and value their employees a bit more, because there are great people leaving, seriously intelligent, well-natured people who are leaving, and it's because of them not feeling valued. And if they get a different role somewhere else, you'll see it straight away in corporate areas. They look after their employees. They know that if they've worked late, or we'll give some amendments for the next day. They look out for stuff. And someone comes in and says, "I'm not feeling well." Okay, you're not performing. So don't try to force yourself. Come back tomorrow. It doesn't allow that in the NHS, and I think that comes across strongly. And so that's how we want to do things differently. Really, we want to make sure that people feel like looked after. We put a lot of money towards sort of well-being budgets as well. So every single Suvera employee gets free access to therapy through a company called Spill, who basically delivers therapy for employees. We don't know who attends them or how many sessions are booked, but we just know that it's something that's available for all employees. And there's also sort of like a well-being budget where we do nice things and get people to take part in it. But the whole point of it always to look after the people. That's all there is to it.
Thank you so much for that. And going back to the NHS, the NHS, we talk about this in every episode. Yeah, the NHS, there's a lot of potential there, I think, to support staff, and there is definitely recognition there. But the problem is again, it's like one of those $1 billion questions. How do you best retain some of your best staff? I don't think that's clearly not being addressed at the moment, or it's not effectively being addressed. Even at the moment, you've got doctors, on the cusp or previously striking or threatening to strike. You've got inflation that isn't really from NHS pay, that isn't kind of matching the overall inflation when it comes to wages. You've got so many things that are push factors that are like, why would anyone stay in the NHS? And especially when the government have invested so much money and time in training some of the most talented people in the world, why is it there isn't as much time and energy in keeping them or retaining them in a system that's in desperate need of them? Do you know what I mean? It's really interesting as what's happening, and I think it's a very difficult problem to solve because of how big the healthcare system is, and there are so many different moving parts. But people like you who have come out of that system and influencing in other ways definitely have the potential to address that. I believe. I honestly believe, like I always say, I think it's easier to really impact and influence the NHS from outside than it is from within. Yeah. And I've seen that time and time again in different forms. But yeah, the key is there, and it's just we need talented doctors and healthcare professionals to really make sure that we get some changes so that our society everyone can access the healthcare that they deserve. Yeah, really. So yeah, well, thank you so much for your time, Will. Really appreciate it. If anyone wants to get hold of you, how do they best do that?
Oh, question. I'm on Twitter, Dr Will Gao. You can find me there.
Awesome. Well, thank you so much, Will. And for those of you listening, we will speak again, I'm sure, and on our next episode. So take care.
Thank you.
Bye. Well, I hope you found that episode really useful for your journey. I've obviously shared quite a lot about my own personal experiences on the mental health side of things, and I can promise you I only scratched the surface. And, the reality is there are a lot of doctors who do need that mental health support prophylactically or preventatively, not just waiting until you get to crisis moment. And I know that many doctors, like myself, choose to move or change careers as a result of the experiences they face in their careers and in their lives. So I really hope that you can take control of your own mental health in a way that works for you, and use that to your advantage in exploring alternative careers. I hope that you found this useful, and please feel free to join our mailing list, as I mentioned before, which is medicfootprints.org/join our mission. Let us know what you think. Connect with me on LinkedIn, and I will be there for the next episode.